Hi, this is Dr. Weinert, also known as the Soul Doctor, and today I wanted to go through a very common condition a lot of people suffer with, and that's chronic pain. The chronic pain, as we know, a lot of people, when you do suffer with chronic pain, a lot of times you're taking pain pills, you're basically just miserable, you're depressed, you're not able to do your normal activities that you like to do, live an active lifestyle, be able to walk your dog, play with your grandchildren or your children. And one of the main issues with chronic pain is a lot of people, they're not able to get the problem solved and the root cause solution for their pain and problems. And that's why I felt compelled to do this video, because I had a lot of patients that I've helped, also family members, and just people in general just wanted me to do a video, because there's I just like to call it a secret that people really don't know about, as far as a solution to those people that are suffering with this chronic debilitating pain. Whether it be in their feet or their knees, their hip, their back, shoulders, even those people suffering with like a sciatica or shooting pains going down their extremities. We will, in this video, I'm going to go through the number one secret solution to be able to help you with that if you or your loved ones suffering with chronic pain. So one thing, as you're probably aware, is I'm a foot and ankle specialist, and one thing that people really don't think about is their feet. And believe it or not, their feet are the most important body part, aside from their heart, that we have, that we have as a human being. And the feet, they're the most neglected, but again, the most important part of the body. And besides breathing, walking is the most common thing that we do as human beings on a daily basis. And if there is an issue with your feet, the feet is your foundation to your body. So when your feet are out of alignment, what it'll do is it'll cause problems not only with your feet and ankles, but eventually what will happen, since it's the foundation and structure to our body, we'll start getting problems with the knees, your hip, your lower back, shoulder area, and then also a lot of these nerve entrapment type issues, where some patients are diagnosed with a neuropathy, but sometimes that can be a compression of nerves within the lower extremity. Most typically your posterior tibial nerve, which is in the tarsal tunnel area, and that will sort of cause patients to have some numbness, burning, tingly sensations in their feet. This again will also lead to having pain elsewhere in the body, because of the compensation component with them trying to walk with that pain. So like I was explaining with the foot, what people don't know, and it's very underdiagnosed, is there are people walking around with a foot that's out of alignment. And what I mean by that is a lot of people are born with it. It's usually hereditary in nature, and most typically your ankle bone, so most of the time you get a little underdevelopment of the ankle bone, and as you walk, the ankle bone sort of slides off of your heel, and it causes like a displacement or a dislocation of the ankle bone on the heel. And then later in this video, I'm going to sort of show with some foot models exactly the pathology that occurs, and then what that pathology will do to the rest of the body for those patients that are suffering with this. I call it misalignment syndrome. Medically, they call it partial talotarsal dislocation. Again, you don't have to worry about, it's more of a medical terminology, but in lay terms, I just look at it as having a misalignment, similar to you know, like in your car when you're driving and your car is sort of swaying over a little bit and the steering wheel is sort of wanting to take you one position. It's a lot of times you just got to get an alignment of your car. Similar to us as human beings, our feet are sort of like the wheels of the car, and we have to make sure they're in alignment, because if they're not, then what will happen is the misalignment in the feet will cause you know, other problems in the upper extremity of the musculoskeletal system. So you know, similar to how we want to get our tires aligned and get when we get new tires and get it balanced, we got to do the same thing with our body. And so as far as getting back onto chronic pain, we've been finding that a lot of patients that are suffering with, say, knee problems or back problems or even, you know, foot problems, it usually a lot of times is it stems from the feet, from the feet having this instability, and that a lot of times will be you know, usually if you go to a foot specialist, they'll be able to evaluate your feet. And when your feet, if you notice when you walk and your feet, the arches drop, or what we call flat foot, that a lot of times will be indicative of having this misalignment of the feet, because your foot is unstable. And a lot of times too, I have patients, if you can, just go to a dollar store and grab a mirror, and then look, have a mirror behind you and sort of look at the backs of your heels. And if you notice, instead of your heels being straight, if they're sort of torqued outward, what we call lateral deviation, or everted medically is what we call it. If your ankle bones are sort of torqued out and your arch drops, that's most typically what we will see, and what can be causing a lot of the musculoskeletal issues and other problems within the body, and even some nerve compression and patients suffering with chronic pain. The other thing too is with chronic pain, a lot of patients are just getting medications from their primary doctors, and basically whether it be, you know, like a pain med or something for the nerves, the problem with being medicated and taking medications is it's not getting to the underlying root cause of the problem. It's basically sort of masking the problem, so it's more of like a band-aid solution to your pain. And most typically we'll see is those people that are taking medications, there's a lot of side effects with them. So just taking your medication, the side effects a lot of times is even worse than what the patient is having, and then what happens is you get these other problems and then more medications on top of it. So a lot of times I'll see patients coming in and with like a menu of medications, which again I feel compelled to get to the root cause and get a solution to my patients' chronic pain that they're experiencing. And I want also people to understand if they have chronic pain, or their loved ones or family member, to you know, watch the video to see what are some things that can be causing that for them. Again, so what I wanted to go through, and I'm going to show you with some foot models, is I want to go through what we call this misalignment syndrome, and also the good news is what we do to fix it. And then I've helped a lot of patients, not only here in the United States but also in Canada, that were suffering with chronic pain, whether it be in their feet or their knees, hip, and back. And they came in with this pain, and we were able to evaluate, and then we were able to do the solution, which I'm going to go through today in our video. and they're able to really get their life back. And you know, I remember I had a pilot from Air Canada, and he really he was a younger guy, and he not only had chronic pain in his feet, but he was also going to the different terminals having issues with pain in his knees and back, and to a point where he'd have to sit down going in between flights, and to a point where he told me that he probably wouldn't be able to be a pilot anymore. He may have to retire early because of the pain that he's having. But the good news is, after he had the solution procedure, which we're going to go through, he was able to be pain-free, be a lot more active, because as a young guy he liked to do, you know, like he did hunting and liked to do different like running and walking dogs and all that stuff, but he was a pretty active guy. But he was able to do all that, and able to, you know, continue being a pilot. And but that's what's nice, to be able to really, it's life-changing for people for this procedure, and not really too many people know about it, and that's the reason why I wanted to do the video, just so I could educate you on what it is and how it will help you. So getting back onto the sort of the pathology that I see as a foot specialist with people is, we'll do a gait analysis where we have them walk, and a lot of times, like I was explaining, their arches drop on their feet, but also a lot of times you'll see that the heels externally rotate, and their knees, they sort of buckle in, and we call it knock knee, where they sort of, the knees, instead of being straight, they sort of want to try to buckle inward. And so as they're walking, and I'm looking at a gait analysis, we'll see sort of some issues with not only the feet, but then we look up the musculoskeletal chain. A lot of times they'll also have the internal rotation up into the knee area, and then we even look up in a little bit higher into the hips. And some patients, if they have one foot that has a little more collapse than the other, they'll have what we call a hip tilt, where the hip, instead of being straight, it sort of tilts to the one side that has more of the hyperpronation or misalignment of feet, or the so it actually drops the hip down. And because of this, like I explained earlier, it's sort of like having a misaligned, your tires misaligned in your car. It's similar to your body. So when the foundation or your feet are out of position or out of alignment, and it sort of causes extra strain on the tendons and the ligaments in the body, because the foot is very intricate, and it's there's over 100 you know, tendons and ligaments within the confines of the foot, and the foot is you know, if there's a problem in one area of the foot, it's going to cause problems in the rest of the body. So this right here, I was going to go through this in here is what the foot looks like. And what happens is that the pathology that we normally will see for the patient, it's right here, and this is the heel bone, and then this right in here is the ankle bone. I don't know if you're able to see, I just want you to see, but the ankle bone is right in here, which we call the talus, and this right in here is the heel bone, or what we call the calcaneus. And so what happens is, when they're walking, the arch on the medial side of the foot, it drops like this. I don't know if you're able to see, but the arch drops, and what that does is it causes instability of all the tendons and ligaments in the foot, but also the joints in the ankle, as well as the foot, and then the rest of the body. And because of this malposition in the foot, it's going to cause other foot problems and ankle problems, as well as other musculoskeletal problems. So I got some bigger foot models I wanted to go through with you. This right in here it's the heel that we were showing on the other model, and then this right in here is the ankle bone. So as you could see, I don't know if you're able to see right here, this is the ankle. Here's the talus or the calcaneus. There should normally be a little, I don't know if you're able to see, there's like a little canal in there. It's called a sinus tarsi, and that normally should maintain opening as we walk, and a lot of times we'll get a little bit of some shift of the ankle on the heel. But what's occurring as we bear weight and we have this unstable foot, this partial talotarsal dislocation, the ankle bone, it slides off of the heel. So every step you're taking, this is what's occurring, and your arch is on this area here. So as it collapses, the arch will drop, and then it sort of as you walk, with every step you're taking, you're getting this abnormal displacement of the ankle on the heel, and we always want to maintain this space opening without it collapsing. And then what we'll do is, when we do the clinical examination on the patient, we also do some fluoroscopic imaging, which is where we'll be able to see the bones in action live. So a patient usually could see on the computer screen what's going on with their ankle and the heel as they bear weight. And a lot of times patients will see with their own eyes the displacement and how the ankle bone just sort of slides and just displaces off of the heel abnormally, and instead of what it should normally be, where it shouldn't slide off and displace off of the heel. So so what we do again with these patients is we'll do the full evaluation, and some, depending upon the severity, there are some patients that they can get what's called a custom orthotic device. And basically a custom orthotic device, it's a device that goes into your shoe. You most typically have a patient take the liner out of the shoe, and then they'll put the little custom orthotic in there, but it sort of helps to correct the foot. Again, it's not 100%. Usually about 60% of patients that have this will get some really good improvement. But see, the problem with the custom orthotic, if you look here at the foot model, is the orthotic, it helps to support the arch and also the heel. However, the pathology that patients are experiencing with this issue, it's up a little bit higher up here in the ankle, instead of coming where the orthotic is it's correcting more planarly. The deformity is a little bit more proximal up, a little bit higher up in the area where the ankle is. So that's why the custom orthotics, a lot of times if they don't help a patient, it's because of the ankle bone sliding off of the heel. It's not being addressed for them. And again, with the custom orthotic, we do digital castings for patients here in the office, so that we have a machine that does 3D imaging, and then we send it to a laboratory, and then they make the devices which patients wear on a daily basis, and they just could interchange them from shoe to shoe. But that's one, I guess you could say, more the conservative way of treating a patient with this condition. But again, it's not, informed patient's not going to 100% correct your issue, since the issue is a little bit farther up into the body, and a lot of times the pain is associated with having that misalignment of the ankle on the heel. So that's where we get into the solution, and what I call the secret of orthopedic, because it's something that's been around since 2004, and it's FDA approved. It's in, I believe, over 60 or even more countries that are doing this, but I call it the feed-align procedure, and what we do is we utilize a small titanium stent that we place between the ankle bone and the heel, and what that does is it'll help to stabilize the ankle on the heel so it doesn't shift. And I try to explain to my patients it's similar to when you have vision problems and you have glasses that you have to help correct the vision, and there's also the surgical procedure called LASIK for people that want more permanent correction of their vision so they don't have to wear the glasses. So the feed-align, where I utilize the HyperCure titanium stent, it is sort of like the LASIK of foot surgery, and as far as with the feet, your custom orthotics are similar to the glasses to correct your eyes, whereas the feed-align procedure, where we're utilizing the HyperCure stent, that is more like the LASIK of the foot, similar to how we do permanent correction for the eyes, but it's doing a permanent correction for your feet. And so what basically the procedure, I'm going to show you with the foot models what it entails is, again, we have the heel bone here, and then we have our calcaneus, and like I was saying, our pathology is we're getting the sliding off of the ankle on the heel. So what we do is we get a stent that goes in between the ankle and the heel, and again, the stent isn't this big. This is just for demonstration purposes, but it goes in between the heel or the calcaneus and the ankle bone, and we make a little small incision in here, and everything is done with a local anesthetic, and we use a very, very, very small minimal incision, just enough to get our instruments in there. But what the stent does is it goes into the area. There's no bone cutting at all involved in it. In the procedure, the whole process usually takes under 20 minutes in there. But the nice thing with it is it gets a patient they come in with a misaligned foot, and then they leave with an aligned foot, and then that forms the arch, and most importantly, it prevents the ankle bone from sliding on the heel. And so you can sort of see here, so the stent sort of acts as a stopper, like I try to explain, similar to like a door stop, but it prevents your ankle from sliding off of the heel. And the nice thing with this is, like I explained, it's soft tissue, and we do it here in our surgical suite here, and we again, we'll just use a local anesthetic just to numb the area right here on the outside portion of where the sinus tarsi is, on the outside portion of the ankle. And then we'll go and do, basically it's more a soft tissue. We have to do some release of some tissues in there. And then we use certain instrumentation where we could figure out what is the proper size stent for us. And this is the exact size of what it looks like, and it's titanium, so very low reaction rate. And what we then do is, with the HyperCure stent, we use the sizers to figure out which is the proper size, and then we then take the titanium stent, and we then place it into that area where the where that little normal occurring space is. And the nice thing is then it'll prevent your ankle bone from displacing and shifting off of your heel. But the great thing with it is it works very, very well, and it's a solution to chronic pain that people are suffering with, because a lot of times, majority of the time, I feel it's underdiagnosed. Not too many people look at the feet, and the feet are really underlying major cause to people's problems, chronic pain, whether it be in their feet or their ankles, their knees, hip, back. But if we correct the foundation to the body and realign it, what happens is the bones and ligaments and tendons, they start to shift into their proper normal position, not only in the feet, but it works itself up the body in the knees and the hips and back. And many patients, after having the feet aligned procedure, a lot of them will get some instant relief. They could see a major, benefit and also improvement in their pain and not only their feet, but if patients did have pain in, say, their knee and back, a lot of them will also state that they're feeling better with that, which is a great feeling. But it also makes sense, because if you could mask a problem, and that's a reason why too there's a lot of people that if they have, like say, a knee replacement, a lot of times after 10 years they may have to get another replacement for that knee, which really should be a permanent replacement. But I feel since the foot had an issue and had a misalignment, it was causing that torque up in the knee and causing that implant to wear down. So if we're able to address the root cause of the patient's problem, and again, the root cause is looking distally and looking at the feet and seeing, is there some type of a misalignment in the feet that can be causing all the other issues in the body. And this is even, we even see it like when the patient has a misalignment of the foot, there is a nerve that courses along the medial side of the ankle and dips into the feet. And some people will have like a tarsal tunnel syndrome, very similar to like a carpal tunnel, like where you get a nerve entrapment in the wrist, but it's actually in the feet. And some patients, once we address the foot and realign the foot, it decreases that tension on the nerve, and the nerve starts to heal itself. And we've been seeing a lot of our patients that had those type of symptoms, but after the feet align procedure, they started to get their sensation back, and they started to feel better and not have the numbness feelings that they had as well. But so that's where I guess you could say the secret or the main solution to people's chronic pain and problems. We first got to look at the foot, because the foot is most typically could be the main culprit of this. But second of all, there is a permanent solution to be able to correct those patients that have a foot that is out of alignment, out of balance. And we're able to do it in a manner that it's a very, the procedure does not take long. Like I explained earlier, it's probably like about a 20-minute procedure that we do here. It's a very small minimal incision. Patients, most typically, they're able to put some weight on it, but we do one foot at a time, because I want patients to put most of their weight on the contralateral extremity, the one that has not been performed. And as long as they do that, we get really good results. And again, it's on a patient-to-patient basis, but that's most typically what we do and what we see. At least myself, what I see with my patients that I see here in U.S. and Canada, and those people that I help treat that have this misalignment of the foot. So I hope this was informative, and hopefully you could sort of see and get evaluated, at least have a consultation, just to see if if indeed you do have a possible misalignment of your foot, and which again, if you're suffering with chronic pain, the feet can be causing a lot of these underlying secondary symptoms that you can be suffering with, or your loved one. So the ultimate goal is that I like to do is be able to help solve the root cause and provide a solution to the patient so that they could live an active and pain-free lifestyle, so that they could go spend time with their kids or their grandchildren, or be able to go walk their dog, or be able to just do normal fun things in life. And that's what I'm here for. So hopefully that this video was educational, but also informative to you, and feel free to pass it along to your your family, friends, and share it. And then also, if there's any comments, please comment below. I'd be happy to answer any questions that you may have. Again, I'm located in Troy, Michigan, and our website, if you wanted to come check it out, it's stopfeetpainfast.com. Again, it's stopfeetpainfast.com. My name's Dr. Weinert, also known as Soul Doctor. And also, if you wanted, I do go through some of this in my new book, which again is on Amazon and also at Barnes & Nobles. It's called Whole Foot Revolution. And I do have a chapter dedicated on what we just talked about, the feet align procedure, and how that could be life-changing for you. So feel free to look that up. Against WHOLE, Whole Foot Revolution, and that you could get it at Amazon, or you could even get it. I have a author book website, wholefoorevolution.com. But either way, I just hope you found this to be helpful. And again, you guys all try to stay safe and healthy. And at least until next time, hope to see you soon. And remember, happy feet, happy life. This is the Soul Doctor. Thank you.